My name is Patrick Jarvis. It is April 14th, 2016. I'm going to verbalize all the proper procedures for performing the apical pulse, stool specimen, sputum collection, and clean catch urine. When walking in the room, I would of course perform all the universal steps for all procedures, including introducing myself, IDing the patient, explaining the procedure, providing privacy, and performing hand hygiene. When performing the apical pulse, I would elevate the head of bed, loosen gown or top, palpate the fifth intercostal to the left of the sternum. I'd find the mid-clavicle where these points intersect at, in, or around the nipple. I'd auscultate over the PMI with the bell of the stethoscope and determine the S1 and S2. I'd count the pulse for 1 minute utilizing a second-hand watch. I'd note any irregularities. I'd replace the gown and document, including any of those irregularities. When performing the stool specimen, I would explain to the patient the use of a hat if using a toilet. Explain that they cannot void or put paper into the hat. I would then provide the patient with privacy and ask the patient to notify me when they are done. I would don clean gloves, assess the stool for color, consistency, odor, mucus, or blood. Then using a tongue blade, I would transfer samples of stool into the specimen cup. If the specimen is for O&P, it would immediately go to the lab. When performing the sputum collection, I would have the patient take 3 deep breaths and cough deeply. Then have the patient expectorate the sputum into the sterile cup. Replace the cap and help the patient get comfortable. Ideally, you want to do this in the early morning. To do the clean catch urine, I would have the patient cleanse hands and their meatus. Then to begin voiding in the toilet, and then put the cup into the stream and collect the amount specified on the cup. Then set aside. Wash hands and replace sterile cap on the specimen. That is it. Thanks.